Right now, we're joined by Jennifer Cox, the Integrated Director of the Mental Health Community Program and Services at Northumberland Hills Hospital. Jennifer, thank you very much for taking the time.
Oh, thanks for having me, York. I appreciate it. Always happy to talk about mental health.
And well, right now, especially, there's always has been, but right now, even more so, there's a lot to talk about. Let's talk
Sure.
about what we're seeing right here in our community and the changes in mental health over the past 14 months.
For sure. I think what we're seeing in the community is, in our community really, is an increase in people who are experiencing more crisis-oriented symptoms. They're having more increased acuity or severity of their symptoms. And here at our clinic, we're also seeing a lot of people who have not accessed the services before. So a lot of first-time access to the service, a lot of first-time clients who are new to the system, who have no prior history of mental health issues, and suddenly find themselves experiencing, anxiety, depression, isolation. And so a lot of those folks are reaching out now, but we're seeing a lot of that across the board for sure.
How are people finding you to reach out to? I mean,
Yeah.
before the pandemic, we were talking about that and the access and such. How are people finding it now?
So we still have our walk-in counseling clinic, which is in partnership with Rebound Child and Youth Services, and so that is operating every Tuesday from 8 to 4 and every Thursday from 10 to 6. And the telephone number for that clinic is 905-377-7784. And so really, when the pandemic hit, we had to pivot that pretty much overnight. We had to pivot that access to telephone so people can phone and leave a message, and then on any Tuesday or Thursday they'll get a call back for a counseling session that same day. So just to put that in perspective, we do also have counselors on site both of those days for individuals or folks who just don't have access to a phone, or who that's just not as helpful for them, and it's just not as convenient. So we do have people on site to do in person. And that clinic is also in partnership, of course, I think I said, with Rebound. So any youth that are coming through that will see a counselor from Rebound as well. But I think the pandemic has really, it's similar to mental health in the sense, for many years when we've done lots of talks about mental health, what we say about it is that it's pervasive. Mental health doesn't leave an area of your life untouched. It doesn't, sort of touch your social life, but then leave your physical life unattached. It's pervasive. And the pandemic is really the same. I think that's what we're seeing. So the pandemic is not something that people are just dealing with in their work lives. They're dealing with it in every part of their life. And so in a similar impact to mental health, it doesn't leave an area untouched. And so it doesn't leave anybody with the opportunity so much to take a break from it.
And the break is definitely needed. How is the pandemic affecting mental health specifically? How is it changed from before 14 months ago?
Well, I think it's really, in my experience, broadened the gap before that exists in all communities. But in our community, it's really broadened the gap between those of us who had some sort of internal resources built up for coping, or maybe we had people that we relied upon, or we could reach out to even through the telephone, or we have access to the internet. We can Zoom call people. So it's broadened that gap between people whose coping strategies or lived experience strategies that they need every day were really reliant on the formal structures or supports, right? So those individuals, even more so now, are really left trying to figure out how to access those services, which have all had to pivot and change, and in waves, right? As we've been hit with waves of COVID, those waves have also impacted how services are delivered, whether they're only delivered in an essential manner, whether they're only delivered via virtually or via the phone. All those things have been impacted. So now what we're seeing is even those individuals who maybe had some strategies or maybe their levels of resiliency that they had built up were a little bit higher, or less impacted. We're seeing those people now whose coping has really been depleted and they're struggling. You don't have to look far now to find more messages around what we should get anxious or worried about, or what's coming, or more waves are coming, so be prepared for this or that. So I think what's happening now is we're seeing more people coming who are in heightened states of anxiety, have low-grade depressive symptoms, and also are crisis thinking. And I use that term as a sense of everything has become a crisis. All of the decisions we have to make are a crisis. If we don't do this, a crisis will happen. If that doesn't happen, something terrible is going to happen. And so normally our anxiety systems are built, I liken them to, if you want to do a comparison, to your common house alarm. So some people have alarms on their houses, and those alarms are set to go off when someone is trying to break into the house. We don't want those alarms to go off when someone is just riding their bike by the house or driving down the street. But now what's happening is our body alarm systems are reacting to that exact thing when there's just information being given to us, or it's not actually an emergency yet, but we're in a heightened state all the time, and we're not really meant for that. So people are operating in that way all the time, and of course, we're having secondary effects from it.
Talk to us about a few of those secondary effects. What secondary
Sure.
effects are you seeing?
Well, people are having difficulty sleeping. They're heightened awareness or anxiety all of the time. So there's that constant dread, the fear. They have which leads to low grade mood, right? So people are feeling more depressed or apathetic. There's a lot of apathy that people are experiencing. So people will say, I tried for the longest time at the beginning. I go for walks. I do all these other strategies to or I have Zoom calls with my family. But they're really feeling a loss of control in their lives, right? A loss of influence or choice. And so that's leading them to that feeling of sort of helplessness, that the walk doesn't provide me with the same level of benefit that it might have provided me with before, or I just can't see where the end is. And so that's creating that low grade mood, that heightened anxiety, that kind of apathy sort of setting in.
Are these symptoms universal from adults, youth, and children, or is there a
Yes.
difference?
So I think they are similar. And I did have a conversation actually with our partner at Rebound Child and Youth Services with Carol Beauchamp. And what they're also seeing is very similar. So a lot of kids experiencing that heightened anxiety and depression, significant issues with self-regulation challenges. And so when you think about adults, right, and maybe some of these kids are living in homes where the stress is higher because we're all under heightened stress right now. There's financial stressors for people who are not being able to work. And so if those additional stressors are existing in our home, they are passed on to everyone in that home. And so kids are also feeling, kids have even less sense of control over their lives or independence over their lives that we do as adults. And that what independence or choices that they did have been removed from them. And so we are seeing a lot of those sort of symptoms of anxiety and depression, that kind of self-regulation, outburst type things. The other thing that they did note is increase in gaming addictions in particular. So it's that, adults look for an escape, and how we look for an escape as an adult could be through other means that are unhealthy, but for kids that could be gaming, right? And it also is that one way sometimes parents are, it's the one way their kids are connecting to other kids because they're chatting with them at the same time, right? But it creates that increased or heightened social anxiety later in life.
We've seen a drastic increase before the pandemic of kids and gaming and screen time and
Sure.
such. How worse has that gotten in the last 14 months?
Well, I think it'll be part of what we'll see is it will be part of what CMHA National across the country is calling, what we're waiting for is the echo pandemic, which is what they're saying will happen after the pandemic is declared over. Something called an echo pandemic, which was the mental health pandemic essentially. So we're going to really see then high numbers of people now, with that so really significant social anxiety, the low grade mood, or the depressive symptoms that don't go away because somebody announces that the pandemic is over, right? They're still and it won't be a one-day thing. So it won't be over on a Monday and then Tuesday we're going to go back to our life as normal. So a lot of those things are not going to happen quickly. So the impact of a year that this has had on our mental health will be felt, is what they're saying, in terms of an echo pandemic. So for a lasting time afterwards. The other thing is, I think that's impacting us is a lot of loss. So there's a lot of loss that's happening across the age span. So if you think about youth, they're losing a lot of their milestone kind of events that we would use to mark things in life, right? So whether it's a graduation or that, or first job, or those kinds of markers in life that kind of mark transitions. Adults are also experiencing those losses, right? So we might be experiencing those in ceremonial things like funerals or relationships, or ways that we would mark a celebration or a transition in our life. We're all missing those things. And I think, maybe before we didn't kind of give them the attention they deserved for what they provided us, right? How we cope with a change in our life, or how we cope with a loss, how we mark it and honor it or acknowledge it.
Is it the case where all these things that you just mentioned are sort of things that we've taken for granted
Yes.
before, right? So the transition going back, like you mentioned, it's not going to be a switch flipping. It's going to be a transition. Where are the challenges there for those with mental health issues to be able to come out on the other side of that and lessen the effect that the mental pandemic afterwards?
Yeah, so we're seeing people who already had pre-existing mental health issues are, of course, more significantly affected now. And the challenges in terms of services being at a reduced capacity and not able to provide as much of the variety of menu of options to those folks that they could before. So there's going to be, the mental health system, as we all know, was already sort of under-resourced in terms of being able to meet the demand that existed prior. What's happening now in our system is that anxiety around how we're going to mobilize to meet what the coming demand will be. What are the ways that we can do that to pivot quickly to be able to meet some of those demands? I mean, one of those answers prior to the pandemic was the walk-in counseling clinic, to try to open up services every Tuesday and Thursday, no limit to how many times you can access that, come as many times as you want, and really make it barrier free as much as possible for people. But I think that you're right, the system will really be challenged to try to mobilize itself with the resources that it has to meet a wider variety of people that are going to want to access it.
And that's definitely going to be a challenge. I mean, it was a challenge before. Now, how long had this walk-in clinic been going before the pandemic? It wasn't very long, was it?
So we opened the walk-in clinic in October of 2017. And then we entered into so then Rebound joined the partnership. Don't quote me on this. I want to say it's in 2018, but I think the pandemic has taken a year off our timeline. That sometimes we're sort of forgetting what's happened in 2020 versus the year before that.
Right.
So yeah, Rebound has joined fairly early on, and then we opened it up now, of course, to children and youth.
Talk to us about the effect that this increase is having on the professionals that are caring for those that are coming in. How are your staff handling this?
For sure. And I think so. I mean, I couldn't be more proud to be part of a team that like this. I think of them really as they have always, people sign up to the helping profession, not necessarily because it's a job. It's really more of a passion. You come to this field because it's a drive that you have. You live this field. This is what you want to do. And so these are really ambassadors of hope, if you will, right? That's what they've signed on for in healthcare, is to bring hope to people, to bring resiliency, to bring strategies to try to elevate their overall health, right? In terms of their mental health in particular is what we do. And to try to also push forward the platform against stigma, right? To really, that's why they signed on to these jobs, right? To really push forward people's understanding and our understanding and knowledge of treatment issues that are available, or options that are available to folks. And so what's happened during the pandemic is, they've really, I think a lot of healthcare professionals are feeling a little bit challenged, right? To be able to bring that hope when it feels like sometimes there is a glimmer of hope, but then how far is it away? And when is that change coming? So those are real issues I think that they struggle with. And they also struggle with not being able to provide always the fulsome range of the services that they have available. And also, I think we shouldn't forget that everybody that's working in the healthcare system, the pandemic isn't just something they're dealing with at work either. So it's the same for all of us, that we're all dealing with it in every aspect of our lives. So at the very beginning of COVID, we opened up the walk-in line, and a separate line in particular for our partners in the community, healthcare frontline workers who were struggling with any issues related to mental health and needed support. So that remains ongoing.
And but it's funny you mentioned that, not funny at all, but I was just going to ask you there. I mean, is there places, are there resources for mental health workers to go to get the help, because they have families too?
Yes, for sure. There are for sure resources. And like I said, we opened up a separate line at the very beginning, and now it's been integrated into the walk-in line. We've reached out to our partners in the community to let them know that we're, happy to provide them with any support that they need. Because we know that, for anybody in any helping role, for them to go out and do their role, we have to make sure that on our end, our resiliency is built up as much as it possibly can be.
You mentioned the stigma around mental health. Do you see possibly coming through this, because there is so much talk now, especially with youth and the mental health issues that youth are facing, not being in school and then back in school and then not in school,
Yeah.
that coming through this, that stigmatism might start to go away because people are actually talking about it openly?
I hope so. I mean, there's been lots of those kind of discussions and glimmers of hope that will happen in the future. And I do think we are in better shape now than we have been. When I first started my career over 20 years ago, we had to go out and ask people if we could come give talks at their locations or at their places of work. We had to ask them if we could come and do that. And now we get asked, right? So, and now here we are talking, right? So I do think over the years that has definitely changed. And there's been lots of big national campaigns to try to bring that or lessen that stigma, really. But I do think the hope lies with our youth. You're right. And I do think that they're going to challenge us to start talking more than what we're even talking now, to start paying more attention, to integrate this as part of any conversation that you would have about your overall health. Right. So to wait, for example, one of the things we talk about when we talk to youth is, or even adults, is when you go, it's kind of a normal thing for us to go to the doctor every year for a physical, right? For your checkup, if you will. But the other piece is you should also incorporate a check-in of your mental health at the same time, right? How you're doing. It's a good idea to get a baseline of what your regular everyday kind of level for your mental health is at. Where does it sit normally? And if the more, because we do that with our bodies, right? We have a headache regularly, those people who have regular headaches kind of know how often they get them, what a normal kind of non-headache day looks like, how a severe headache day looks. Well, the same should be true for our mental health. What does a regular day look like? How do you know when you're sort of not doing as well? And the reason for that is then you can kind of circumvent it before it gets to that place where we're kind of saying, oh, well, just put it off, it'll go away, it'll get better. We have less in that way. I'd like to change our thinking so we don't tolerate a decline in our mental health in the same way we don't tolerate a decline in our physical health.
Exactly. Very, very good point there to end on. Jennifer Cox, thank you very much for taking the time to join us. Much appreciated.
You're welcome. Thanks for having us. I really appreciate it.